So there were 11 deaths within 6 weeks. Obstetrical cause, so that was between 43 days and a year, was 2, and then there were 2 that they didn't know the cause. So here is the question on the death certificate that speaks to if this mom was pregnant at all during the past year, because this is going to help them pull out the data that they need to then to help to improve our morbidity and mortality rates. So there it is. So what can you do to help? I don't know, I don't have access to changing your flow sheets or whatever, but just you might consider, asking additional questions at the triage point to women of childbearing age, and to become familiar with the postpartum warning signs. And I am going to give you out, we're giving these out to all of our patients now at discharge and reviewing it with them in hopes that they'll put it on their refrigerator. There's some great YouTube clips of moms that have been like, oh, I had this, oh, I should call, and then that was helpful. So that's one way that we easily can help. And just being aware of the maternal morbidity conditions that I reviewed, and just encourage you to reach out to our OB providers on call, because they can definitely help guide the care, so that, because that's what they're there for. And we also have, that's the sheet that I'll give to you. You can keep down in the ER if you want. And then this is a great, I don't know if you're aware of this, but our the postpartum period is a critical time where the mental health component is huge. And so there is a support group on the island that meets the first and third Sunday of every month in Southwest Harbor. It's run by Sarah Toohey, and it's open. You don't have to, you just stop in, and there's no charge, and it's been really well received in the community. So I just want everybody to be aware of that group for the importance of just their mental health and such. So that's kind of the bullet points that I wanted to pull out from the conference. I have my resources in here as well. I'm happy to share this PowerPoint if you want. I printed out a few copies, but
if I can have a copy of it, then I will share it with the staff.
Okay,
That'd be great.
So yeah, there's so much that you learn in those conferences, and you look at this data and it's overwhelming and things, but I thought, I guess of all the units in the hospital, after us, you guys are seeing these moms, and if you ever have any bleeding issues, concerns, definitely reach out to us too. What's that?
Anybody who's had a baby, call me.
Call me. Yeah, for sure. But yeah, any questions or?
No, good info.
Yeah, I just didn't realize that whole year component.
Yeah, I
It can be
didn't even realize.
It's
the
important in
whole
the whole morbidity piece to all the work that's being done in the country. So, oh yeah, so can I leave Chris with these, and I made some flyers. If you have any postpartum
that's awesome.
patients that come through, just put them in their discharge paperwork. I just think we can't give
Thank
them
you.
enough stuff. And yeah, cool. And let me have a few minutes.
Yeah, they treated for possible PE.
Right, and she'd been pregnant,
Yeah, she was just,
wasn't her baby?
seems like a
4
couple,
days old, wasn't
yeah,
it?
she had a
Wasn't-
newborn. It
Yeah, it
was-
was like 4 days old or something
Yeah,
like that.
she didn't have one.
Oh, I remember, she didn't deliver with us, she delivered in Bangor, but had a C-section, and, yeah, I had heard that, yes, she had come in, because we had seen her for, breastfeeding support.
Yeah, she was having
And
chest
weight
pain,
gain.
that's why.
But yeah, so, yeah, she ended up getting,
Keep the rest.
yeah, you guys were spot on, got
She
her all
was
worked
okay,
up and she
though.
got to go home,
Yeah,
yeah.
she didn't have one, but
Yeah.
I don't know what the diagnosis was.
But she's pretty, she had a lot of risk factors, surgery and, yeah. Yeah, interesting how
So, I mean, so
dangerous
it does-
the
so it
OR
does
can
happen. I
be.
mean, it does.
It does
She
happen.
was, yeah.
We had another we had a patient too, postpartum with shortness of breath, in OB too, and, yeah, they're big, you gotta listen, we listen to them,
Yeah.
right, for sure. Yeah. Am I the end of your day?
Yes, you
Yes,
are.
thank you so much.
Awesome.
We'll be down in
Yeah.
a few minutes, they'll bring food.
I'll probably just eat more of it. Today's a bust on my diet, that's
Yeah.
sure. Not that it wasn't very good.
I know I should have eaten those Stacy's chips, those are so good.
Oh, those are great.
Hey Patsy, can you get the lights on your?
Oh, certainly.
Actually, all the things I have, the fresh bought have been bought.
And if you wanna just leave your evals with me, I can
Oh,
put
I
'em
never
in.
drew one.
I forgot to go down there, I can carry some.